This exercise is called the squat and it develops strength in the gluteals, quadriceps, and the hamstrings. The starting position of a squat should consist of having the barbell resting on your trapezius, not your neck. Ensure the squat rack is at the right height, so when you finish the exercise, you can easily put the barbell back on without struggling, as this can become dangerous. Your feet should also be just outside shoulder width, with your toes slightly flaring outwards. When squatting, the goal should be that your hip joint is below your knee joint, and that is when you know you are hitting enough depth on the squat. A key coaching point is that a lot of people have their heels come off the ground, and this is due to poor ankle mobility. So exercises for ankle mobility can help then hit the depth on the squat that you need. You can also only hit the squat depth that you need if you stand away from the squat rack at an appropriate length, probably around 2 steps backwards. To progress the squat movement, you can obviously add more weight and load, and you can also try squatting only using one leg. Regressions for the squat can include lowering the weight and then also putting a box underneath you, so when you do squat down, you can sit on the box before then powerfully exploding upwards again. When taking the barbell off the squat rack, you don't want to go onto your tiptoes, as that will then use the gastrocnemius. For a squat, if we are trying to increase hypertrophy, I would recommend 3 sets of between 6 to 12 repetitions, using roughly 70 to 80% of your 1 rep max. Whereas if we were trying to improve strength in the muscles, I would recommend more sets, roughly 4 to 5, with lower repetitions, between 3 to 5, using over 85% of intensity of our 1 rep max. If you are using a greater intensity, there are safety arms you can use on the squat rack to stop you from failing a repetition and from getting injured.